Right. So I think COVID pandemic actually has posed, probably the most difficult supply chain dilemmas around the world, both, intra and extra sectoral burden of morbidity and mortality, along with unprecedented commodity competitions. And I see, Aisha actually alluded to that, as to how things are happening actually. But I think it's a great learning that we have. I'll be actually sending out my notes, at the end of the meeting. But what you see is basically starting with a good note, I would say. The government, Dr. Shahid, Dr. Safi Malik, the minister and others actually have been taking care of, many things of what instruments we have been using on the supply chain side. Actually. So I'm very happy this slide is just for your quick, snapshot as to how USAID and the government of Pakistan are actually using digital partnership against COVID. So when you see travelers surveillance management information system or a PPE calculator for quantification, or it is an NDMA procurement and inventory management module for PPEs at the national level with public and private sector, or working with the TCS, for example. And I'll talk about where transportation is for the family planning and reproductive health, is all happening actually in these very, very difficult times. So coming back to our subject, I mean, if you see in this slide, the situation is not very good. And as you see, except, I have actually divided my, commodity stock situation. And given, the coverage that we should anticipate from the Department of Health as compared to what nicely Population Welfare Department or private sector might have been doing, if you look at this slide, I've divided into internationally procured commodities and then nationally procured commodities. So you see, except Punjab, where we have, stock on hand for condoms about 8 months, and Sindh is very good, on most of the commodities, internationally procured. And then on the local, locally procured contraceptives, you see, Sindh, Balochistan, and KP are doing good. But if you look at the long-term methods, which Dr. Tosif kindly alluded to, is absolutely non-existent from the entire public sector, except for the So this is not a surprise, I'm sure, as you know. I mean, during these times, there's a lot of competition in terms of who is going to get PPE, to make sure that they are able to render their jobs, whether reproductive health and planning, or the most important, saving lives of patients in COVID critical situations. It's a very, very competitive situation where I think a balance to family planning and reproductive health is something that we are all charged to create, but it's not an easy situation. Now, coming back to where are the resources, I know that, all the provincial governments have been doing a wonderful job. And in this slide, that we have been coordinating with all of you, including departments of health. You see, this is the latest, update on the financing, right? Starting with, government of KP, joint procurement for PWD, DOH, DMP procurement has been completed, tender re-advertised for the reason that, internationally procured, products were not, those vendors were not, participating, and that is a big challenge continuously for the last 1.5 years for KP. Now coming back to Punjab joint procurement, financial bids have been opened for PWD. Thank you. They are doing, despite this, challenging times, financial bids have been opened by PWD. Then is our Balochistan government, PWD, procurement for all contraceptives except copper-T has been completed. Condoms have arrived, but unfortunately the entire Department of Health for our Balochistan women and men is just not responding to family planning requirements. Also in the past, but also in this situation as well, except for population welfare. Coming back to government of Sindh, I think we don't have much issues on both internationally and locally procured products. LC will be opening in June, so hopefully that will be a time when the government of Sindh will be able to procure all these on time. And then I think last but not the least, we heard from Dr. Kram on the GP side, but I'm very happy to share with you, and I'm sure it's all the leadership from Dr. Shahid and his team, work orders have been issued for AJK, Gilgit-Baltistan, and ICT. I know those are supposed, but these products are coming. I know that you are facing difficulties, but these are in process. At least locally procured and locally manufactured products will be available down the road in a month. Now, coming back to where we are, I'll take this my last slide actually. And my recommendations are, while we are competing, from an international perspective, I have been actually coordinating with my USAID colleagues in Washington and my own colleagues who are looking after the contraceptive supply chain in coordination with UNFPA globally. We see that China and India, who are the most important producers and suppliers of contraceptives, there is going to be a big delay, except these are, Synapris, DMPA subcutaneous or, intramuscular, condoms, implants, they're all very constrained. Condoms as well, but only the IUCD, I think they have a global, kind of supplies as soon as the, international freight opens, and that should not be a problem. But all remaining products will be a problem for the times to come. So we need to be ready. But fortunately, Pakistan is very good in terms of local production. So I would say at least, although these are, short, contraceptives, short time, but they will be available. Now, my recommendations, are that in addition to local advocacy to donors, which where UNFPA is very kindly actually, taking forward all the donors, USAID and, TIFID, who are main active donors for Pakistan. We should also reach out to FP 2020 as a group for an extraordinary support. I know that we are not part of the 16 commodity countries, but there may be something that, as if Dr. Shahid, the minister side could write a letter to the FP 2020 Secretariat for some extraordinary support in addition to what UNFPA is doing with coordination of the local donors. And then also, I think, help each other on loaning, adjusting. I know, there are stocks, more stocks, less stocks, but whatever stocks we have, I would say, if there could be an interdepartmental and interprovincial stock loaning and adjusting, let's continue those, good gestures to each other, just to make sure that, we are not hungry of those commodities, which we can actually manifest a good coordination at this, time of challenges. Then while we are struggling to compete PPE, I know that, there was a good discussion going on, that we would require planning and, practical staff to render family planning services. And this is the biggest challenge as to whether we feel comfortable to be in the field or not. But I think, at the same time, we need to make sure, that transportation in Pakistan is intact. And if we can actually, can take care of, maybe some contracts with, Pakistan Post that is open, Leopard, Muller and Phipps, TCS, they're all open. If we can make use of those, because as you see, at the STP level, there is an impending and some facilities are absolutely, 100% stocked out. So maybe this is a time where you can actually use, these private sector vendors to make sure that last mile commodities are available, as what Dr. Steve and other partners have mentioned. And then I think pay attention to LMI's data within a district. I know this tool has not been used as much as it should be, but within a district, we see that some facilities are poor, some facilities are understocked, and some are absolutely stocked out. So I would say, please encourage from your perspective as to make your DPWs and, other EDU health and, other people at the district health authorities, to use data to make sure wherever there are high stock, they can actually transfer it. So that, we can optimize stock distribution within at least 4 or 5 kilometers that we can easily do. And then I know that we have been talking about this, but not from the perspective that I feel. I don't think we have been using digital solutions. Private sector has been on the forefronts of reaching out to a number of, population where they claim that, they have established, contacts with their clients. I would say they can use digital solutions to make sure that their faithful clients are having some provisions of products, from somewhere. I know these are constrained times, but at least those products which are available should be connected to those clients in some innovative and, creative manners, actually. Lastly, I have shared this already with you, but, protocols We have developed, very good protocols of people who are working in store and, in distribution, jobs. You can make use of that. I'll stop here. Thank you very much. And I'll be very happy to answer any questions that you may have. I know these are constrained times. We may not be able to fulfill 80-85% of the requirements of the supply chain and family planning requirements, but these are times of competition, and we should do whatever we can to balance out service and for family planning services, especially with the help of the private sector, which have more resources at this point in time as compared to that. Thank you, sir.